So today we're talking about CranioSacral Therapy, which is just something I just love and adore because it is A, really effective, and B, really gentle. And the craniosacral system is your skull and your sacrum or your tailbone. And there are a number of bones in there, and there's the cerebral spinal fluid. So it's a closed system because the cerebral spinal fluid doesn't go anywhere but that system. It moves through your spine, so all of your nerves are impacted. And the bones of the skull, it's been found, move, and they move by about the width of a hair. So it's very, very small movements. But if you think about a garden hose that gets crimped off, things just aren't flowing quite as well. And when the bones of our skull get crimped off, our cerebral spinal fluid doesn't flow as well, which means all of our nerves to all of our body are not being supplied and fed as well as they could if that hose was flowing smoothly. So because Cranio can work and smooth out the cerebral spinal fluid, which impacts every part of your body, obviously there's a lot it can do. Some of the things I love working with are low back pain, our headaches, our scar tissue, and just smooth flowing in the digestive system. Anytime we have people coming in just that level of physical and emotional trauma, they get cranio. Cranio is gentle, and because it's working the fascial layer as well as the craniosacral system, the body feels listened to, not imposed upon. And so, like if somebody comes in with a broken leg, their body's kind of in a little trauma because depending upon how they broke it, let's say they fell, there's the embarrassment of falling, there's the pain, there's the questioning about how am I going to keep driving, who's going to take care of me and until I can get back on my feet. And so the body's kind of feeling oversensitized and not really paid attention to because it's also been poked and prodded and maybe casted, and there's all sorts of things going on. And because that leg is hurting, it's causing compensation patterns throughout the body. So maybe the opposite shoulder is starting to hurt. And with the craniosacral therapy, we listen to the body, and the body feels like somebody's paying attention to it. And so it doesn't have to up the pain level to keep getting the attention. You can expect that you'll be lying face up on the table. You'll be dressed in loose clothing. Your shoes will be off. Any belts or anything in your pockets will be off. I'll start working at your feet, kind of traction, see where I feel tension or restriction, and then I work my way up the body. At one point, one hand is going to be under the tailbone, under the sacrum, and the other hand goes where it feels called. Sometimes it's a waiting game and I'm just holding points very lightly. Sometimes it is following bodies through movement. After a session, you can expect to feel very relaxed. In the example of the broken leg, people walk out easier than they walked in because the tension is gone, the restriction is gone, the compensation patterns are gone, and so people just feel easier in their body. So I have been trained in the up-ledger line of craniosacral therapy. I have been through advanced cranio. In massage school, I helped TA CranioSacral Therapy for over 2 years in that setting. I've TA'd with Upledger. I have studied the work of Hugh Milne and the Heart of Listening. I've been exposed to osteopathic craniosacral therapy primarily through George Eversole and the Aqua Stretch, and I have been exposed to the biodynamic theory of cranium. They all have slightly different ways of getting to what they get to, and they all show up and have the body guide them. And the first thing I fell in love with cranio about is this thing called the platform. And the platform is something that you get under the occiput in the little muscles, and supporting the head and allowing those little tiny muscles to relax and release provides so much relief for headaches. And the platform is why I fell in love with cranio.